That's 191 more than yesterday. They can be broken into two groups, 37 that are connected to known and contained outbreaks, and 154 cases that are currently under investigation by our public health team. We yesterday again broke a testing record on a single day, 26,554 tests, and again let me thank every single Victorian who consented to being tested. It gives us the data that's so important to us, understanding where the virus is and exactly what challenge we face. That brings our total testing since January 1 to 979,253 tests. It is almost certain that we will breach the 1 million tests when we count testing activity that's going on today. There are 35 Victorians in hospital and 9 of those are in intensive care. There are 772 active coronavirus cases across the state and of course there are many thousands more close contacts who are being worked with in terms of trying to contain the spread of the virus. Now, public health team is doing that very important work as best they possibly can. In terms of the high-rise towers, there are 69 cases that can be linked to the towers, up from 53. There's some reconciliation of data, so known positives, but not where there was necessarily a connection to those towers. But that number stands as of test results received when the daily report was put together at 69 residents. I'll come back to the towers in just a few moments. Before I do that, though, it is important that I make a few comments and then make some very significant announcements for metropolitan Melbourne. These are unsustainably high numbers of new cases. It is simply impossible with case rates at this level to have enough contact tracing staff, to have enough physical resources, no matter where they come from, no matter what uniform they wear, in order to continue to suppress and contain this virus without taking significant steps. If we were to fail to take those steps, then it won't be a couple of hundred cases per day, it will be many more than that, and it will quickly spiral well and truly out of control. Cusp of a second wave, what people want to call this is entirely irrelevant. We have to be realistic about the circumstances that we confront. We have to be clear with each other that this is not over. And pretending that it is because we all want it to be over is not the answer. It is indeed part of the problem, a very big part of the problem. We do have a chance to change that in the decisions we all make, in the way we conduct ourselves, in the way we reset. And that is why the public health team have advised me to reimpose stage 3 stay-at-home restrictions. Staying at home except for the 4 reasons to leave, effective from midnight tomorrow night for a period of 6 weeks. There is simply no alternative other than thousands and thousands of cases and potentially more, many people in hospital and the inevitable tragedy that will come from that. I think a sense of complacency has crept into us as we let our frustrations get the better of us. I think that each of us knows someone who has not been following the rules as well as they should have. I think each of us know that we've got no choice but to take these very difficult steps. It was a long night and we have been working throughout the day to get all the data we possibly could to make the best evidence-based, science-based decision about what the next steps should be. If I can run you through the detail of these decisions, and then of course we're happy to take any questions that you have. But essentially all the local government areas and Mitchell Shire, which I regret to say, unlike the rest of regional Victoria, there are an unsustainably high number of positive cases in Mitchell Shire. So all of those metropolitan local government areas plus Mitchell Shire will be the subject of the stay-at-home order from midnight tomorrow night. Those 4 reasons, which are well known, they will extend to each and every person across the metropolitan area. That is to say, much like the settings that apply to those 12 lockdown postcodes. We have seen more positive cases in those postcodes, and we have also seen leakage out of those postcodes and infections in other parts of Melbourne. And then when you add all those together, when you get an aggregate picture, we know we're on the cusp of something very, very bad if we don't take these steps today. There are a couple of differences to the stay-at-home order this time as compared to last time. You will be able to go out to go to work if you have to go shopping for the things you need when you need them, to study, to provide care or to get care. People are well acquainted with those rules. Daily exercise, though, will be treated differently. You cannot leave metropolitan Melbourne to get your daily exercise. There are a number of, now, on the advice of the Chief Health Officer, very low public health risk activities that will be permitted that were not permitted last time. But the most important point to make around exercise is that you can't be going on a 4-hour bushwalk hundreds of kilometres away from Melbourne. You can't be going fishing, again, outside the metropolitan area down into regional Victoria. Regional Victoria has very, very few cases, and vast parts of regional Victoria have no cases. This is designed to keep it that way. And I hope very soon to be able to be before you again talking about further easing of restrictions in regional Victoria. That's not for today. I do hope that is quite soon, and we'll only be able to achieve that if we continue to contain within metropolitan Melbourne and not see large outbreaks or additional cases in regional Victoria. In terms of principal place of residence, stay at home means just that. Not stay at your holiday home, not stay at your second home. Your principal place of residence is where you must be, except for the 4 reasons to leave your home. This is, I know, further than we went last time, but we are in many respects in a more precarious, challenging and potentially tragic position now than we were some months ago. The notion of people continuing to move around the state from one residence to another is a risk that the public health team are not prepared to take, and on that basis the stay-at-home order is about your principal place of residence, your actual home, not a second residence, wherever that might be. In terms of schools, of course, this will be of great concern to parents, to teachers, to school communities right across the state. We've made a number of decisions, and there are some others yet to come. Let me tell you what we have already decided. From Monday, Year 11 and 12 students, so VCE students and Year 10 students for the VCE component of their learning, if they are doing VCE subjects, will return to, as normal, face-to-face learning. That is principally a function of the fact that as older students, they are able to maintain physical distance, they are able to be much more careful in getting to and from school, and indeed many of them, certainly a much higher proportion than younger cohorts, will get to school on their own. They won't need to have parents taking them and picking them up. That is seen as a much lower risk, and of course every day at school is important, but for those Year 11 and Year 12 students, we want to make sure that their VCE is not any more disrupted than it already has been, and we want the certificate of education to be meaningful across both regional Victoria and metro, and having 2 very different settings I think would potentially cause us some issues there. In addition to those Year 11 and 12 students and the Year 10s who do VCE subjects, specialist schools will also will reopen or will come back from holidays, and there'll be face-to-face programs as per normal from Monday. That is in recognition of the very significant challenges that those higher needs kids have and their families have. Learning from home, flexible learning, the feedback from parents, from teachers, from those who know and understand those challenges best is that is not a practical option, so they will return to school as well on Monday. As for all other students, we will extend the school holidays for a further week. There will be 5 pupil-free days next week. Teachers will be at work, they'll be at school, and they will be doing 2 things. firstly, preparing for whatever the balance of the term may look like, and we will make further announcements once we see more data, once things are a little more settled in the coming days. Again, giving parents as much notice as we can. And the second function that at least some of those teachers will be performing is for parents who are working in essential jobs that can't be done from home. So whether mum or dad are stacking shelves at Coles or Woolworths, or whether mum and dad are a nurse or a police officer, those kids will be able to be taken to school, and for next week there will be a supervised school holiday program for them. We will, before the end of this week, we will finalise what our plans are for flexible and remote learning at the very latest, early into next week, so giving parents as much notice as possible. But those arrangements will be in place Year 11 and 12 back to school and specialist schools back to school on Monday, business as usual. And for the rest of our kids, we will make further announcements quite soon. But for those who are the children of essential workers or people who simply can't work from home, there will be supervised school holiday programs for them. And just finally, there is a week's extension of the school holidays to give us some more time to plan, some more time to get more data and to see exactly the most contemporary picture of the challenge that we face. In terms of, and I might add, there has been consultation in the last couple of hours with the Catholic and independent sectors, and I think that we'll be able to get a broad agreement and have one setting that'll apply to schools right across our state. We'll update you on that as we have those details to hand. In terms of the public housing towers, the 9 towers that remain in that hard lockdown, I just want to assure everyone across the state that there are literally thousands of people, and if I can give a shout out to the Lord Mayor, to other local government, to Andrew Crisp as the Emergency Management Commissioner, who's down there essentially running each element of our massive response to this challenge, can I send a very clear message to every resident and to every Victorian who is concerned for those residents. We all are. The strategy here is to complete the testing, and then, as soon as possible, once that testing is complete, to have those 9 towers move to the same footing that the rest of Melbourne will move to at 11:59 p.m. tomorrow night. A stay at home with 4 reasons to leave. Now, those who test positive, like any person who tests positive across the state, regardless of their postcode, regardless of their landlord and their close contacts, they would of course need to be treated differently. And we may have to put some very specialised and targeted supports and measures in to look after those people who test positive. This is not going to last a moment longer than it needs to keep those residents safe and to have what I know are very, very challenging measures, but they are proportionate to the risk when you consider, as we've said many, many times, the fact that so many people in those 9 towers are among some of the most vulnerable people in our Victorian community. Just finally, on those towers, can I indicate my thanks to everyone who has donated food, their time, all of our partners. They're all doing an amazing job as best they can. It's not easy, it's very challenging, and we do recommit ourselves every moment to doing even better and to meeting the needs of those residents. It is a very challenging environment. I want to make it clear that there are literally hundreds of staff, both clinical and support staff, currently going door to door in those tower blocks, testing, and the response from residents has been very positive, very strong, and we will get those samples off to the laboratory. We have dedicated capacity to get those tests done as quickly as possible, and I don't think other Victorians will mind priority being given to those samples, given that they're in the hardest lockdown that we've seen anywhere in our state. We'll be able to update you further tomorrow on the total number of tests that have been taken, but the early signs of that really intense phase, which has been the story of today, are very positive. Just finally, just before this press conference, I spoke with the Prime Minister and informed him of the decisions that I had made on the advice of the Chief Health Officer. I want to thank the Prime Minister for his consistent support, and I also want to share with you that I have requested from the Prime Minister a number of further supports. As you know, we've had significant ADF personnel in the State Control Centre. We've had significant ADF personnel out helping in some of our mass testing sites. We will also, I should make note of many hundreds of Commonwealth public servants, so not ADF, but many hundreds of Commonwealth public servants who've been helping us with our door knocking and other community engagement work. I can inform you that I have asked for a further 260 ADF personnel to principally help with on the ground support, whether it be in staging areas, planning, logistics, transport. They will essentially support Victoria Police as Victoria Police put in place roadblocks and other command centres to ensure that that hard boundary between metropolitan Melbourne and regional Victoria is not breached by people who should not be leaving metropolitan Melbourne because the purpose of their visit is not permitted under those 4 reasons to leave home. It will not be every car being stopped. It will be similar to the approach that Victoria Police have taken in those 12 postcodes that are locked down. It will be booze bus type arrangements on main thoroughfares. I would just appeal to Victorians, don't for a moment think that you could flout these rules and travel into country Victoria. There'll be every chance that you will be stopped, you will be asked, and if you don't have a lawful excuse, then there are significant penalties that will apply. Victoria Police have always taken this seriously, and they will continue to. That is what we need. We need to make sure that anybody, and hopefully it's a very small number, if any, but if there are any Victorians who do the wrong thing, then Victoria Police will be out there to make sure that you're not making choices, selfish choices, that put not only your own health at risk, the health of your family, but indeed the health of every single family at risk. Essentially, all of us have to be realistic about the circumstances we face. No one wanted to be in this position. I know there will be enormous amounts of damage that is done because of this. It will be very challenging over these next 6 weeks. The alternative, though, is to pretend that it's over, just like I think some Victorians have been, wanting it to be over desperately. And I get that, I understand that. But we can't pretend it's over. It is not over. It is not over in so many parts of the world, and it is not over in metropolitan Melbourne, and indeed, to a certain extent, right across Victoria. There's no change to the rules in regional Victoria, but there are still rules and they need to be followed. We will do everything we can to support business, to support anyone and everybody who is impacted by this. Of course, you've got the notes and the details, but stage 3, of course, means that those venues that had been cautiously opening up will have to go back to takeaway service only. Other businesses that had opened will have to close. I know and understand how significant that will be. I know and understand that there'll be a big job for us to continue providing support. Tim Pallas and Martin Bakula, as the responsible ministers, will have more to say quite soon about further business support, and I'll be having further conversations with the Prime Minister about some of the very special needs that Victorian businesses are going to need met over these coming weeks and months. Again, every Victorian needs to understand this is not over. It is not something you can pretend and wish away. It is here and it is going to be with us for a very long time. Without a vaccine, without a cure, without better treatments, if we didn't take these steps today, I will not be standing at this podium saying there's 191 cases. I'll be reporting hundreds and thousands more than that, and then it will get right away from us and we will have thousands of people in hospital, and we all know what that means. That means tragedy. We've already had 2 further Victorians pass away in the last 36 hours or so, and I again send my condolences to those families. We don't want to see any more of that. We don't want to see any more tragedy. And if these steps were not taken, and if we all don't start taking this a little more seriously than we have been, then we will see that. No one wants that today. No one wants that at any point. We can't just go back to normal, despite the fact we all want to. We have got to find a COVID normal. And that means you can't pick and choose which rules you follow. You can't let your frustration get the better of you. We've all got to do the right thing. Otherwise, we will not just have tragedy, but we will certainly have a prolonged period of really impactful restrictions, these and potentially more. This is an opportunity to reset. This is an opportunity to work together, and we're all obliged. Not an opportunity to do the right thing, there's an obligation to do the right thing for your family, for every family. Please follow these rules. There's simply no acceptable alternative. I might ask Brett just to add to my comments, and then we're happy to take any and all questions you have.
Thank you, Premier. This is certainly awful advice to have to give to any government, but it is absolutely necessary. It's painful to have to say it, it's painful to have to go through it and to flag that we've got 6 very difficult weeks ahead of us. But we have been through this before and we did it successfully. We turned the tide with our first wave of infections in Victoria and we drove infections right down again. We're facing as significant a situation this time around, but if the advice of my public health colleagues, infectious disease colleagues, is anything to go by, there is a unanimous view that this is required to avoid absolutely catastrophic outcomes. Indeed, thousands of cases per day, and I know that we will already see deaths from the cases that we have occurring every day. What I do not want to see is any more deaths than are already predicted. We have to drive our daily numbers down. What's happened has been a very significant upturn in the last few days. We did have 2 or 3 days where numbers were 60 or 70 a day. We knew that we had made new restrictions on gathering sizes. We knew that we had gone through a really significant period of engagement with the communities most at risk and where transmission was greatest, and that we really stepped up our efforts in testing. That was with the hope that we didn't need to have to go to another level of public health directions that would be imposed. The last 2 days have shown that that is not going to be adequate. It's been very useful. It needs to be part of our continued efforts, but it is insufficient to drive cases down. And it is only through the imposition of these measures, these really, really difficult measures, that we really have any chance of turning this peak around and saving lives into the future.